Welcome back, guys, to another episode of Your Girls, your favorite girls on the screen.
Back in the studio.
You know. And by studio,
My living room.
yeah. But you know, we gotta make do with what we got.
I have had a surprising amount of people ask, where do you guys record? It's so, like, that wall is so cool. I'm like, it's my house.
It's just a nice wallpaper. Mm-hmm. I really like that wallpaper a lot.
I do too. It's a vibe.
It is. Well, I'm Aicha.
I'm Sara.
And we're hard pressed.
Yeah, baby.
Today's topic.
ADHD.
But we're not here to tell you, we're not professionals. We are very much aware of that. Mm-hmm. We are not here to tell you what not to do, what to do. We're not a professional. Plus, you're supposed to get this diagnosis from a healthcare professional. We're more so here to talk about our experiences, per usual. We're more so here to give insight to what we've experienced, what I've experienced, being around folks with ADHD.
It's a hot topic.
It is a hot topic.
So we're here to share our experience and perspectives that maybe you thought of, maybe you didn't think of. Mm-hmm. The point is to increase awareness, but also change the narrative when it comes to ADHD, that diagnosis, and how people interpret it and how they perceive it for themselves.
Mm-hmm. So let's start. Who has ADHD?
So I was diagnosed with ADHD in my early adulthood. It was post-college. So I got through all of grade school, all of college, did pretty well for myself, and finally, went to a professional because I was starting to understand what ADHD could look like, in women versus men, in young adults versus kids. And it's always been something that I've been cautious about because of how I was raised, my parents' perspective on medicating children. It's just, like I said earlier, it's a hot topic.
It is.
So now that, I'm an adult, I can make my own decisions, I can think for myself, and I'm intelligent. I decided to get tested and am now, perfectly functioning in my own way.
Not because of the diagnosis, but because of Sara.
Right. And the whole point is I don't identify as ADHD. I have an ADHD diagnosis. Mm-hmm. And my goal is to better understand the difference in my brain function versus your brain function as someone who is not diagnosed with ADHD. Mm-hmm. I'm not here to use it as an excuse, but use it as a way to understand how I function and almost life hack the way that I approach day-to-day tasks to make it simpler for myself.
Absolutely.
Knowing what I know.
I really like how you presented that.
Thank you.
Yeah. So, talk to me why you chose to get diagnosed. What led up to the decision? Because it wasn't.
That's a good question.
It wasn't during your childhood. It was during your adulthood. So, what made you think?
Well, if I'm being completely honest, I took Adderall every now and then in college. Mm-hmm. I just was not prescribed it. Mm-hmm. Don't put me on blast.
Every health professional is like, oh.
But it was, it's hard to say exactly what it was, but I knew that I was easily distractible. Mm-hmm. And I knew that I was more strongly affected by my audio-visual surroundings than other people. It really made it difficult when I was in a busy place. At first I thought it was, I was anxious, but it made it very difficult for me to even engage in a simple conversation with someone. In college, I remember the moment where I had taken Adderall and I was having a conversation with somebody outside of an academic building right after class let out. And I was engaged in the conversation. And I thought to myself, holy cow, this is what this is like. Huh. Okay. Maybe I should pursue this a little bit.
How did you know that what you were experiencing was not normal?
I didn't.
So what made you take Adderall? A kid? College kid?
I was cramming for exams.
Okay, so more so just to, okay.
Yep. Yeah, I needed to like stay up all night. It was not a healthy approach to taking Adderall. I wasn't
Okay.
aware of, oh, I'm having symptoms right now that could lead to an ADHD diagnosis. I should take Adderall and see how it affects me. No, I did it as like a college student who hadn't studied at all for exams and needed to stay up all night to study.
So, okay. More so I was finding out, like, did you talk to someone and say, like, oh, yeah, when I can have a conversation when a bunch of people are going out. So you made that deduction all on your own just for that experience.
Yep.
That's
yeah,
funny.
that's what initiated it.
I've taken Adderall once. Again,
Oh,
not
gosh.
prescribed for me. But I
can't imagine.
and you know, and my personality is like I can narrow in and
You're
stay
good at
focused.
focusing.
But it was for an essay. We had to stay up late. It was a huge essay for high school. And I took a very small dose. It was like half of 5 milligrams, so 2.5.
Wow.
It was tiny. But when I tell you I was uncomfortable, my heart was racing, and I couldn't focus on anything else but my heart racing like a bunny rabbit.
Yep.
Just like, I'm sitting there like, oh my gosh, this is not, I will never, ever again take
Right.
any pill that's not mine.
Yeah, if you are not meant to take Adderall, it's really
Not for you.
not fun.
No, it is not fun.
Because there's been a time when I have taken like 5 milligrams too many, and it's very uncomfortable. So I get to my baseline prescription, which is actually very low compared to a lot of people. I'm realizing I'm prescribed 30 milligrams a day. I take 25 in the morning and then 5 in the afternoon. I mean, I know people that are prescribed. I know kids that are prescribed 50 milligrams a day. So it's a very low dose. But I have gotten to the point where I have allowed my body to get used to it and get comfortable on it and not continue to increase, because I now know, okay, I'm at a baseline level of functioning, attention span, and the ability to basically compartmentalize. And I feel like I can attack the day better. Okay. I can take on the challenges that the day is going to bring.
Okay. What symptoms do you have? How do your symptoms present themselves? Because that's one thing that ADHD looks very different on everyone.
Yeah, I was very hesitant at first to even use the H in ADHD because I never thought I was hyperactive. But when looking into it a little bit more, hyperactivity doesn't just mean, a hyper young boy that you might picture when you think of the most commonly prescribed person. My symptoms, kind of like I mentioned before, are being overly stimulated by audiovisual things around me. If I'm in a conversation and something's going on in the other room, or someone has music on or a TV show, if I feel like my audiovisual stimuli is maxed out, I can't focus on anything except for that TV. So that's the main thing. And then as I've gotten older, one of the symptoms that I experience a lot is not knowing where to start. being significantly more overwhelmed by the day-to-day tasks and just not starting, not knowing, not out of a, it's out of a disorganized mind, not out of a lack of motivation or know-how. It's from the disorganization inside my mind. Sometimes I just will freeze. I just don't know where to go
almost
next.
Looks impossible to
Exactly. Yep. I know that I can do it, but I have a very hard time figuring out
do.
how.
Yeah. Now, we didn't discuss this prior to prepping, so I want to see how you feel about this one. You had to come off Adderall, obviously, when you got pregnant.
Yep.
How was that like?
It was so hard. It was so hard. And it was cold turkey for me.
Obviously, yeah.
I found out it was a surprise.
Yeah.
And I stopped immediately. And I mean, it was my first pregnancy. Not that I've had another pregnancy before, but as a new mom, I was very cautious about my caffeine intake, which is good. That's great. So I quit cold turkey, both of those things. And it's kind of hard to say how it would have impacted me if I were in the office because I got pregnant at the very start of COVID. So I was working from home, but it had a significant impact on how I managed my day-to-day tasks. I used to be, I don't want to say I used to be, when pre-pregnancy, when I was taking my Adderall regularly at work, I was very methodical about how I approached my day. After I got pregnant, I felt like I was jumping around so much more. Had a much harder time grasping, all right, this is what you need to do now. This leads to that. But honestly, it's kind of hard to compare because my day-to-day function changed significantly regardless.
Okay.
Because we were working from home. So naturally, there's so many more distractions. And it's just an environment that makes it a lot harder to stay disciplined about your work.
Now, outside of work, what was that like? Being pregnant, not being on Adderall regularly, obviously not being Adderall at all. How did that change? Like, just outside of work, how did that change on your day-to-day? Because I have a follow-up question that I want to ask once you answer that one.
Okay. So are you asking how my social life
How
changed,
everything changed.
Okay.
Because, I mean, knowing you, I know the impact versus, I know how I interact with you with Adderall versus without.
Right.
I'm cognizant of that. So, because I had this other question I want to ask you. I want to know what everything else was like.
Very scattered.
Okay.
Feeling like there was a lot bigger sense of something's wrong with me. And I really didn't have a ton of understanding. In my mind, it was still a stigma. Yeah. It definitely was still a label or like a disability. I didn't have the same view now. I didn't think I had a disability, but the people around me on a day-to-day basis didn't experience those symptoms, so it was very hard for them to relate and understand and, not view it in a negative light.
Yeah. Moving forward, should you get pregnant again, do you think you'd have a better experience?
Absolutely. Absolutely.
Because you obviously will have to stop the medication cold turkey once upon,
Yep.
again. Maybe you'll have more planning and reduction.
Right. The
tapering off.
Yeah. It would be much more planned. And I would be intentional about weaning off of it, basically.
Okay. What would you do differently knowing that you won't have this medication? How do you think you'd proceed a little differently?
A lot of different things. I would still allow myself 1 cup of coffee a day because research has shown that that's acceptable when you're pregnant. But I would take better care of myself because I know it has a significant impact on my ability to focus. I would fuel my body. And these are things that I did not do in my first pregnancy. I did not eat healthy. I had the mindset of, well, I wasn't working out before I got pregnant. It would be unhealthy of me to start working out now. And so it was just a cycle of weight gain, you know, issues in my relationship, issues with my own self-confidence, just all the things combined. I was not taking care of myself. And so that would be the first thing that I would do is pay special attention to my diet, how it affects my ability to focus, and my exercise. Make a point to exercise. And on top of that, not just personal health, I think with my workflow, I would have to be significantly more structured with my boundaries at work and very clear, because I know how interruptions and things like that affect me, even when I am taking Adderall. Really what it boils down to is being mindful of the effects.
I like it. I thought that'd be interesting to see, next time around how that's going to be different for you.
Yep. Plus, my partner is so supportive when it comes to mindset, taking care of yourself. I mean, there's no way that I could get pregnant and not take care of myself in the relationship that I'm in now.
No, absolutely not. Absolutely
No
not.
way.
If I were living here at the time you were pregnant,
Of course.
that would have been
Of
the case.
course. I mean, it needs to come from within.
Absolutely.
But having support is incredibly helpful.
Yes. The support that pushes you to be better.
Right. Someone who doesn't make you feel ashamed, but who also has the same view of understanding.
And prioritizes health.
Right. Right.
I think that's very important. So for the sake of our listeners, because, at the end of the day, we want to try to provide some tools, not advice, tools that we use in order to improve our efficiency, really make our lives better. So in your case, what do you do on a day-to-day? What would you recommend if anyone is struggling to find the tools that could help them? I mean, the tools are relative to the person, but what have you done that you think may be helpful for someone else?
So, first thing is own your actions. Don't let this diagnosis become a crutch or an excuse. It is so easy to just brush off a lack of focus and say, oh, I'm ADHD, I can't help it. No, you can. It's a lot harder, but you can help it.
It's the drive and the will to do so.
Exactly. So a few things that I have noticed have been so incredibly helpful for me. Some of them are so simple. It's like micro habits. There's two broad focuses that I've found I've made improvements in. First one, organize as much as possible. Simply. Make it a simple organization process that you can adhere to regularly.
For example, give us an example.
For example, color code your planner. I have my color code memorized. Blue is my daughter's schedule. Purple is my employee schedule in the office. Pink is anything on my own schedule, work-related. Red is appointments. Blue is personal and social. Not blue. Green is personal and social. And I write everything down. I do not ever expect myself to remember a meeting, even if it's tentative. Write down tentative meeting and just keep all your colored pens and some whiteout, because you're going to need the whiteout. Keep it in your bag.
Okay.
That has been so helpful for me with organizing, because my brain sees Saturday. It sees green writing. Awesome. I have something fun, social planned. I see a day with a lot of pink writing related to work. I know, okay, you're going to have to really focus up today. It's a busy day. Prepare yourself in advance. Not even knowing what those meetings are, I know that I have 3 meetings on the books and it's going to be a busy schedule. So I have to plan my night accordingly. Like, even my outfit. Wear something that makes you feel good. Like, you are confident and you can really tackle the day.
That's really cool. I didn't even think about that. I just learned something new about you. And really just really a great life hack. Being able to look at your planner just by the color, not even reading what it is. It's like those pink, bunch of it. You're like, oh, there's going to be a lot of work day. Let me put my outfit out before, like the night before, because I know it's going to take me a lot longer to plan for this outfit because I'm having to meet clients. I have to mentally prepare myself going to bed. Like, all right, tomorrow is going to be a hustling day. I mean, it's always a hustling day, but just more so. I have to mentally prepare to be on.
Exactly.
On.
And that preparation happens very early for someone like me.
And that means I'm going to have to wake up a little bit earlier, give myself more time, make sure I get to the office earlier so I can prep for these meetings and make sure that everything is in order. Because you might, like you said, you have to give yourself more prep time.
Yep. And I want to be in a calm mindset too.
And not rushed.
So I don't want to be rushing in the morning, trying to get ready, panicking. Oh, shoot. Show up at work. I have a 9:30 meeting that I totally forgot about. Nope, I already knew about it.
Sets the tone for the entire day.
Exactly. Yep.
I like that. That's even helpful for someone who doesn't have a diagnosis. I like that.
Yeah. It's super helpful.
Just gonna jot that down.
Another really simple thing is eliminate any excessive, unnecessary noise or stimulus where you can. You can't just put on noise canceling headphones all day and shut out the whole world. That's just not functional. That's not a functional human being. I envy you if that's what your workplace is like, but it's probably not.
It's nice.
But for example, my purse when I'm driving gives me so much anxiety because I will step on the brakes and it will fall over and all the contents will fall out. And that's all I can think about for the rest of the drive is the fact that my pens are rolling around all over the floor. And
that's so funny.
I know. And it's so stressful having things moving around in my car when I'm driving. When I go to turn and I know that something in the trunk is going to shift, it stresses me out. It pulls my attention. Instead of staying focused on the road, I'm thinking about, is the stroller going to hit the window?
That's so funny.
So I got this purse holder. Simple organization tool. I hang my purse up on the back of my seat. Now it doesn't fall over.
Yeah.
Ever. It's great. It is. I'm so proud of that achievement. It's so simple and it seems so silly, but it makes such a big difference. I think the reason I'm so proud of it is because it is so simple.
Yeah.
But it makes such a big impact. I'm like, oh yes, this is a life hack for sure.
And you don't have to worry about it while driving.
Right.
And you're focused.
There's no maintenance.
Yeah.
I just open the back door and hang my purse up.
And that's it.
Keep it moving. Yep.
What else you got?
So the second sort of broad topic is automate as much as possible. Because for me personally, the little things, there are so many things in life that add up to create this mental block or this chaos in your mind of bills to remember with due dates and grocery lists to remember and recipes and all the other adult things that everyone has to deal with. Just because I am diagnosed with ADHD doesn't mean I have more on my plate than other people. It just means that my brain processes all those things in a very different way. So when you can automate things like that, you can clear your mind of the unnecessary things that are repeated every single month. Every month, your bills have to get paid. If every month you're realizing you're 3 days late on your bills because you forgot, or you got that email and got distracted and didn't go on and pay your bills, that's a problem. That's stressful, and it ends up resulting in poor credit, which then leads to other stressful circumstances. And so it's this unnecessary snowball effect of stress for the simplest thing. If you can't get your bills paid on time, you can't function. You're not going to be a successful adult, period. So get that stuff on autopay. One thing, grocery shopping, hate it. I cannot stand grocery shopping. It's because of the stimulus. Because I go into a grocery store and I see all the options, the music, the people around me, you know, if I'm with somebody, the stress of not wanting to stop in the middle of the aisle, all the things. Thinking of, you know, checking my list on my phone and then getting a text message and then going to that text message and replying to the text and then being like, wait, what was I shopping for again? That is so stressful. So I set up Alexa to just be in my kitchen for the sole purpose of generating shopping lists. It has been so helpful, and I need to plug her back in because I don't know what. And I haven't really done a grocery shop in months probably, aside from for my daughter, because I haven't had Alexa plugged in.
I think we unplugged her for this very reason.
Thanks, guys.
I think we use her adapter
to
plug in.
You're right. But automating that process of not having to remember sitting down and thinking, okay, I have to get butter. Thinking through all the things that you would have to get, which you do. You told me that you do that. You just go through the list. You know, you like walk through your day, your rooms. I cannot do that. Oh my gosh, that is way too overwhelming.
I love grocery shopping. I love grocery shopping. I was telling my boyfriend maybe I should get a part-time job and do like Instacart for folks because I love grocery shopping.
People are you love grocery shopping because you go to Whole Foods and Trader Joe's.
Yeah,
you're gonna be going to Food Line and Walmart and be like, "This is terrible."
Well, I think I can accept jobs I want, so I'll be sedity and be like, "Nope." Whole Foods and Trader Joe's only.
Oh my
Harris
gosh.
Teeter is my only other option.
Bougie.
But I will just, I'm also very involved in the kitchen, so I'm constantly cooking, constantly snacking, constantly making a tally in my head of like, okay, remind myself to put this on my list.
How do you remember to put it on your list though?
I mean, also before I go grocery shopping, I'll do a quick walkthrough. And then, like, everything gets triggered. Like, okay, you remembered. I mean, my memory works
that's
different.
amazing.
So I'll look in the fridge and be like, oh, yep, that's right, you did. And don't get me wrong, I'll forget some things. You know, come back home and be like, oh, my gosh, I'm supposed to get this thing. But for the most part, just doing a walkthrough,
Sorry.
Rude.
The thought of grocery shopping.
I'll just remember just by doing that walkthrough.
Wow.
But it's just...
I have to brain dump. And that, honestly, is another really great hack, is just brain dumping. Have one notebook that you just write down. When the thought pops in your head, write it down. And at the end of the day, look through, and this is not something I do, but it's something I should do. It's something I do at work.
Okay.
Whenever I think of something that I have to get done, I write it down on my to-do list, and then I organize that to-do list. So that way, I at least have 40 sticky notes all over my desk with things that will remind me, oh, don't forget to get back about whatever this event may be to so-and-so. That would have totally escaped my mind had I not written it down and put it physically on a sticky note on my desk.
Okay.
So it creates this illusion of disorganization when really it helps me calm down internally and look at everything and think, okay, I need to do that first. I need to prioritize this. I've got sticky notes. I can literally put them in order of what's most important, most urgent, and what's not. And then I can organize it later.
Okay.
So brain dumping.
Brain
It
pooping.
is, yeah. Well, it's called brain dumping.
As soon as you said that, I was like, I'm going to get you a notebook that has a brain and then a poop sign.
Oh my gosh.
And that'll be your brain dump book.
Okay.
I'm literally
Gonna like
like looking at, what do I look up on Etsy?
Oh, it's so helpful just to get it out of your mind. I actually did this last night. You know, I say I don't do it, but I'm getting better about the practice of doing it. I was thinking of all the different things that I had on my to-do list because post-holidays, it just feels like, all right, let's go. Let's get organized. It's almost like spring cleaning,
Okay.
at least in my head. You know, we're heading into a new year. I want to get a head start on all those things. I want to organize my life, simplify things, and just make it easier for myself. So all these things were going through my head about, oh, I could clean out the fridge. I could do all my laundry. I could clean the apartment. I could get ahead on work. I could clean out my car finally. You know, all the things. So I just
Wrote it all down.
I put it all in my app and in my task app and organized it in the morning so that I would have some direction. So clearing your mind
Okay.
is so beneficial.
So if we have to do a synopsis, color coordinate a planner.
Yep.
That's been helpful. Simplifying things as simple as like getting a hook for your bag in the car, things that actually bring you a lot of stress and distractions.
Right.
So yours was the bag rolling on the floor. Doing, automating your bills, just automating any process, like your groceries, just having Alexa to say your groceries to so you don't forget. And then finally was brain dumping.
Think about what it is that causes the most chaos in your mind, whether it's a physical stimulus or a mental stimulus, and come up with a simple solution to eliminate that as much as possible.
Okay.
2 of your very important people in your life, myself included, deal with ADHD. What's that like for you?
It took a lot of learning because I did contribute to that stigma once upon a time.
Right.
I was definitely guilty of it. But the more I learned about it and dating someone with a more severe case really opened my eyes to it. And really, I took an abnormal psych class last year, remember? I think it was last year. And I learned a lot during that class. I learned so much during that period too, because I'm somebody who, the more I learn about it, the more I can understand. I mean, that's really just a general thing, but scientifically learning about it and how the brain is impacted really opened my eyes to it. But that didn't happen until dating someone, like I said, with a more severe case, just because I knew you had it. You're so disciplined about making sure. I think more recently you've become more disciplined about making sure you're consistent about your tools and your medication on top of all the other things that were advised to you. So you were pretty on top of it. But then again, I've seen you not take your medication. And even then, my awareness of it when you're not taking your medication, I adjust by saying, okay, she just might take a little bit longer to do a task. And I have to be patient because I understand that it's not because she wants to be like this or because she's doing this on purpose. This is genuinely something like, it's a little harder for you, or really anyone I've encountered with this diagnosis. And it's not, I think the stigma is that I've seen is as if it's on purpose or like it's really not that hard. It's like, okay, do you think they want to experience this? I'm like, no.
Yeah, it's actually very hard.
Yes, I see it. I've seen your brain shut down as you're about to do a task that you don't necessarily want to do, or even like you don't want to do it because it's so much harder than it needs to be. So I've seen firsthand what a brain looks like when it's shutting down for doing a task that it really can't do.
It's not even that we don't want to do it. It's that we don't know where to start.
Exactly. So it took learning about ADHD. It took understanding that it manifests in different ways in different people. Some folks are more hyperactive than others. My partner is pretty hyperactive. And like I said, has a more severe case. So it took seeing that to really help me understand even more like, oh, okay, this can be a bigger issue if I don't do my part of learning and being understanding and patient and adjusting my expectations. So my boyfriend, his is time management that he really struggles with. And it took me understanding that it's not necessarily that he's intentionally doing these things. He really doesn't mean to. It's that he just, what he thinks he can do in 2 hours is way more, it's not realistic. So he has a hard time thinking about like even just, for example, getting ready to get somewhere on time. He thinks that it takes him 15 minutes, but he doesn't take into consideration the time it takes for him to pack or put, find his keys, his wallet, getting into this car, or even just like the little things it takes for you to get from inside your apartment to in your car, like everything in between. He doesn't really think about that. And he's gotten a lot better about, he thinks more big picture, but he's not looking at all the little steps. So that's something I've learned about him. And he's also now more aware of it. Like, I have to look at every step and time block every step along the way. But that also is something he learned from me, to remind him that's actually not a realistic timeline to have. So managing my expectations, understanding medicated versus unmedicated during that period. Being
That sounds so bad.
No, I don't want it to sound bad. It's just more so I have to be cognizant of it on how to proceed, because I can't expect something to be done in how exactly I want it to be done when you guys' factors are not considered.
Right.
And so that's something that's I think that's my part as somebody in on the other side, is understanding
absolutely.
I have to think about these things, and for my own frustration, so I don't get upset or frustrated when things aren't being done on my timeline.
It goes both ways, honestly. Like, it could be any personality trait of yours that affects your boyfriend the same way.
Absolutely.
It could be the rigidity that you have with your schedule.
Yep.
It can be the same thing, just not a diagnosis.
Exactly. So it goes both ways. And finally, my role as my man's girlfriend, knowing that his is a little more prominent in his life. Not that he wants it to be, and he doesn't want it to define him, and I don't let him. I encourage him not to, and he doesn't want to as well. But more so, he'll get frustrated with himself and upset with himself, because he just is like, I don't like being this way sometimes. And my role is to remind him that there's nothing wrong with him. It's just his brain works differently. It just means he has to work a little bit harder to normalize or, perform normal behaviors.
That's so great that you can give him that, because it makes such a big difference when you have a partner who is supportive of you and understanding. And I'm just thinking about how my boyfriend is aware that I get overstimulated by too much noise, and he will just turn down the music or turn off the TV show or stop talking, even because he knows.
He'll see it.
And he can see it. He can feel it in my body language. It's amazing when you have a partner who is aware of it and doesn't make you feel bad. It's great to have a partner that will hold you accountable and not allow you to use it as a crutch, because it's so easy to do that. But who will also understand you as a person and love you and support you in a way that they know that you need it, because it's very hard not to beat yourself up when you're not catching on to something as quickly, or not processing something, or you have to say, I'm sorry, say that again, because this conversation was going on, and now I'm worried about you feeling disrespected, or like I'm disinterested in this conversation. It's a lot. It really can be difficult to manage.
Yep.
I hope this gave some insight into, shed some light on the stigma behind ADHD, and really the stigma behind taking medication in general for something that's considered a mental health diagnosis, and not allowing that to run your life.
I think this is a good time to mention that the things that we've talked about here don't necessarily only apply to folks with ADHD, because some people can experience this without this diagnosis completely, because there's other factors, of course. So the reason I'm saying this is I don't want this to be taken out of context. What we say here is only folks with ADHD
Right.
can experience this.
And just because you experience this doesn't mean
you have ADHD. There's so many other factors that go into it. Like I said, just healthcare professionals will be the perfect person to guide you on that. But I definitely wanted to make sure that is known, so that way it's not taken out of context or misconstrued. But I hope this helps, one, provide insight to the things Sara does to make her life easier with this diagnosis, and two, the things that I do to help myself and Sara and my boyfriend. Well, thank you so much, guys. Like, subscribe, share, love, follow.
If you guys have any other life hacks, whether you have an ADHD diagnosis or not, share them.
But we will see you guys next week. Thank you so much.